So guys, I'm going to ask Dr. Joet about something. Let's go. Doctor.
Yes.
Well done.
Thank you. Well done.
Doctor, last time we discussed about stroke, but there are some things that I want you to talk about today.
Yes, about stroke.
Yes, we never talked about them.
Yes.
So, Doctor, what are the warning signs of stroke? We never talked about those ones, but I think they're important that people will know.
Oh, well, yes. It is very important to know the warning signs of stroke. And surprisingly,
Yes.
most of the people experience these warning signs, I think 6 months even before the stroke happens.
Oh.
But many people don't take notes of them. Not because, but I think because people are not aware of them. So it is really a good question to highlight some of the warning signs of stroke so that the population can know and take care of, take control of their life. One of the major warning signs that most of the patients that get stroke experience is severe headache. You see, a patient will keep complaining of headache, but the patient is not taking time to go and take his blood pressure.
Okay, so doctor, that's the headache that most patients come complaining that all the NSAIDs are no longer working.
Yes, they experience that headache. They do tests, malaria, to ensure that they find out the cause of this headache. But if the blood pressure is not taken, they will not understand. They will not know, that the headache is coming from that. You understand?
Yes, sir.
Another thing these patients experience is dizziness. Sometimes they feel dizzy all the time, but they don't notice that. You understand? Some of them will experience loss of vision. Some of them will experience face dropping. A patient will come when he cannot open the mouth well, or the mouth has deviated to one side. The face has shifted, to one side, right or left, depending where the stroke is.
Yes.
Some of them will come with left or right-sided weakness. Out of the blue, the patient will tell you, doctor, I feel my hand is very weak. I feel my leg is very weak. Those are all warning signs of stroke. Another thing that some of them experience is slant speech or difficulty in speaking. When you note such signs in a patient, please find a doctor. Let the blood pressure of this patient be taken, because those are some of the warning signs that this patient experiences of stroke.
Okay.
Yes.
So, doctor, you've said the warning signs of stroke. We have slurred speech, one-sided weakness.
Yes.
Okay.
Yes.
And loss of vision, severe headache. Okay.
Exactly.
That one I've grasped. But okay, doctor, let's talk about something like how can someone prevent stroke?
Well, that's a good question. Anyone can prevent stroke in some of these ways. One, have your blood pressure controlled. Do you know that some people, they know they're hypertensive, but they don't want to take medication to control their blood pressure?
Yeah.
So the number one thing to control or to prevent the stroke from happening, adhere to your medication for hypertension. When you control your blood pressure, chances are low that you will get a stroke.
Yes.
Have your blood pressure taken frequently. Even if you're normal.
Yes.
Even if you're normal, have your blood pressure taken. There are so many people who even don't know their blood pressure. As a doctor, I would advise that at least every 3 months, have your blood pressure checked out, because you will be able to control the stroke from happening. Number 2 or number 3, quit smoking, because we have seen smoking is a risk factor.
Risk factor, yes.
That predisposes this person to stroke. So if you're smoking, please quit for the best of your life.
Yes.
Another one, quit taking alcohol. alcohol also predisposes you to a stroke. So when you quit alcohol, it means the chances of having stroke you have reduced them.
Yeah.
Number 4, exercise. Burn those calories.
Hector, don't do that one. That
You know?
one.
Yes. Many people don't want to exercise. People are using vehicles from morning, uses the vehicle, goes to work, comes home, eats, sleeps. You know? Sleeping in the morning, gets in the vehicle, goes to work, comes home. So there is no way
Sedentary lifestyle. Sedentary lifestyle.
Yes, there is no way this person is cutting the calories.
Yes.
You understand? So these are fats that fails and predisposes you to a stroke. Another way you can control is by eating well. Eat healthy food. Feed the brain. You know, good food that keeps the brain healthy, like fruits, fish,
Yes.
all grains. All those are foods that can keep this person brain healthy. You understand?
Yes.
Control your sugars.
Okay.
You understand?
Yes.
This person is diabetic. So when you're diabetic, control your sugars, because we know when your sugars are controlled, the risk of getting a stroke also
Yes.
also
Control.
lowers. You understand?
Yes.
So all those things, I would say, when you do them, the chances of preventing a stroke from happening really goes down. So as I finish, I would advise every person watching me today to have their blood pressure taken, because when you know your blood pressure, it is a weapon to help you master how your health is moving. Because I've seen a lot of young people are getting stroke because they think blood pressure measurement is for old people.
Yeah.
If I may ask you, how many times have you taken your blood
Actually,
pressure?
I think I only take blood pressure when I'm sick. That's during
You get my
trials.
point?
Yeah.
Do you get my point?
Yeah.
So we really call upon everyone, take your blood pressure and comment in the section how your blood pressure is, then we talk.
Okay.
Thank you.
Doctor, thank you so much.